Picture this. A man in his mid-60s, silver hair cropped short in a military cut, stands at the reception desk of Westside Regional Hospital. His weathered hands grip the counter as he leans forward, desperately trying to make his case. The fluorescent lights above cast harsh shadows across his face, highlighting the deep lines of concern etched around his eyes. He's wearing a faded Navy jacket with a Vietnam veteran patch sewn onto the sleeve, and he's clutching a VA referral form that's been denied 3 times already. "Sir, I've explained this to you before. Without proper insurance documentation, we cannot process your request for specialized care," says the hospital administrator, Dr. Rebecca Wells. Her voice is clinical, detached. She doesn't look up from her computer screen as she speaks, her fingers continuing to type. "The VA referral isn't sufficient for our new policy guidelines. But I've been waiting for 7 months. The veteran, Frank Martinez, replies. His voice trembles slightly, not with fear but with the effort of containing his frustration. The pain is getting worse. "My doctor at the VA said this procedure is time-sensitive." Dr. Wells sighs, finally meeting his gaze with cool indifference. "I understand your situation is unfortunate, Mr. Martinez. But hospital policy is hospital policy. Perhaps you should try the county facility downtown." She slides his paperwork back across the counter with manicured fingers. "Next, please." Frank stands there, stunned into silence as someone brushes past him to take his place at the counter. He carefully folds the rejection letter and tucks it into his jacket pocket alongside the others. As he turns to leave, he doesn't notice the woman sitting in the waiting area, observing the entire exchange. Dr. Eliza Chen, the newest addition to the hospital's surgical team, watches as Frank slowly makes his way toward the exit, his gait uneven, favoring his right leg. She tilts her head, eyes narrowing slightly, as she watches Dr. Wells efficiently process the next patient, a well-dressed woman whose expensive handbag costs more than most people's monthly rent. The contrast is jarring, unsettling. Dr. Chen's fingers tighten around her coffee cup, knuckles turning white. Little did everyone know that simple interaction would set in motion a chain of events that would transform not just one veteran's life, but an entire healthcare system. Let me take you back to where it all began. Dr. Eliza Chen had built her reputation on exceptional skill and unwavering dedication. After graduating top of her class from Johns Hopkins Medical School, she completed her residency at Mayo Clinic, specializing in vascular surgery. Her colleagues often joked that Eliza's hands were steadier than a robot's, and her mind sharper than a surgical scalpel. But what truly set her apart wasn't just technical skill. It was her approach to patient care. 3 weeks ago, she'd relocated to Riverdale to join the surgical team at Westside Regional. The move surprised many in her field. Westside wasn't known for cutting-edge medicine. But for Eliza, the decision was personal. She'd grown up in this town, watching her father, a Vietnam veteran himself, struggle to navigate the complex healthcare system. His early death had been her catalyst for becoming a doctor. "With all due respect, Dr. Chen, your methods may have worked at your previous hospital, but Westside has established protocols," Dr. Wells had explained during Eliza's orientation, her voice carrying that same dismissive tone Eliza would later hear directed at Frank Martinez. "Our priority is efficiency and financial sustainability." Eliza had nodded politely, absorbing the unspoken message. Don't rock the boat. But Eliza had never been one to sacrifice quality care for convenience or cost-cutting. Her new office still smelled of fresh paint and recently installed carpet. Family photos adorned her desk, her father in military uniform being the most prominently displayed. A bookshelf housed medical journals, many containing articles she'd authored on improving veteran healthcare access. On the wall hung her numerous accolades, including a recent Humanitarian Service Award for establishing a low-cost clinic for veterans in her previous city. Riverdale itself was a study in contrasts. The hospital sat on the affluent north side, surrounded by manicured lawns and luxury car dealerships. The expansive building featured gleaming windows and a recently renovated facade that projected prosperity and cutting-edge care. But just 15 minutes south, across the railroad tracks, lay the other Riverdale, working class, struggling, forgotten. Eliza had chosen to rent an apartment on the south side, much to the surprise of her colleagues. "You know there are luxury condos right next to the hospital?" one surgeon had asked incredulously during her first week, but Eliza preferred the authenticity of the south side. The small, family-owned restaurants where owners knew customers by name, the community gardens in once vacant lots, the vibrant cultural mix that reminded her of her own diverse upbringing. Each morning, Eliza's routine included a stop at Veterans Park, where she'd sip her coffee and watch elderly veterans raise the flag at dawn. Many of them reminded her of her father, proud, resilient, and largely overlooked by the very country they'd served. She'd exchange pleasantries with them, learning their names, hearing snippets of their stories. This was her true orientation to Riverdale, not the sterile hospital halls or administrative briefings. On this particular morning, before witnessing Frank's rejection at reception, she'd noticed him at the park, sitting alone on a bench, reviewing his medical documents with a furrowed brow. She'd made a mental note to say hello when she saw him at the hospital later, assuming he was a patient on her schedule. What she didn't know then was that Dr. Wells had been observing her closely since her arrival. Rebecca Wells had built her administrative kingdom on predictability and protocol. New doctors, especially those with Eliza's reputation for patient advocacy, represented potential disruption. From her office window overlooking the parking lot, Rebecca watched Eliza arrive each morning, noting her interactions with the maintenance staff, the way nurses already seemed to respect her, the growing number of patients requesting her specifically. "We need to keep an eye on Dr. Chen," she'd mentioned to the hospital director the previous day. "She hasn't fully embraced our efficiency model." As Eliza now sat in the waiting room, witnessing Frank's rejection firsthand, something shifted within her. The coffee in her hand grew cold, forgotten as she watched the veteran slowly make his way out of the hospital, shoulders slumped in defeat. "Excuse me," Eliza says, approaching the reception desk after Frank exits. "I couldn't help but overhear. Was that patient a veteran seeking specialized care?" Dr. Wells looks up, her expression professionally neutral upon recognizing Eliza. "Dr. Chen. Yes, but his paperwork isn't in order. Standard procedure." "I see," Eliza replies, carefully maintaining her composure. "And what exactly was missing from his documentation?" "The VA referral isn't sufficient on its own. He needs approval from our insurance verification department first, and his case doesn't meet our priority guidelines." Dr. Wells' tone makes it clear this conversation is over, but Eliza persists. "I'd like to review his file if possible. I have experience with VA cases." "That won't be necessary," Dr. Wells replies, her smile tightening. "Mr. Martinez has been informed of his options. Perhaps you should focus on your scheduled surgeries, Dr. Chen. I believe you have a full slate today." Eliza nods slowly. "Of course. Thank you for the reminder." She turns to leave, then pauses. "By the way, I'm starting a review of our surgical outcomes across different demographic groups. For research purposes, I may need access to administrative records." Something flickers across Dr. Wells's face. Concern, perhaps. "Any such research would need board approval." "Naturally," Eliza says with a pleasant smile. "I'm simply gathering preliminary information. Have a good day, Dr. Wells." As Eliza walks away, she doesn't see the way Rebecca's eyes follow her, narrowed and calculating. Nor does she see Rebecca immediately pick up the phone to make a call to the hospital director. That evening, Eliza finds herself parked outside the Veterans Hub, a community center serving former military personnel. After asking around, she locates Frank Martinez at a support group meeting. She waits patiently until it concludes, then approaches him. "Mr. Martinez? I'm Dr. Chen from Westside Regional. I witnessed what happened today and wanted to speak with you, if you have a moment." Frank looks surprised but nods. "Not much to talk about, Doc. It's the same story veterans have been telling for years." They sit in the corner of the now empty meeting room, and Frank explains his situation. A complication from an old combat injury has created a vascular issue requiring specialized surgery. The VA approved his referral to Westside because they lack the equipment for the procedure, but the hospital keeps rejecting him due to insufficient documentation. A bureaucratic runaround with no resolution in sight. "How long have you been trying to get this surgery?" Eliza asks. 7 months of referrals and rejections," Frank sighs. "Meanwhile, this leg gets worse. VA doc says if it's not treated soon, amputation might be the only option left." Eliza feels a surge of anger but keeps her voice steady. "Mr. Martinez, with your permission, I'd like to review your medical records. I'm a vascular surgeon and this happens to be my specialty." Frank studies her face, looking for any sign of insincerity. Finding none, he reaches into his bag and hands her his file. "Knock yourself out, Doc. Can't make things any worse." It takes Eliza less than 10 minutes to confirm what she already suspected. Frank's case is textbook, a procedure she's performed dozens of times, with excellent outcomes. There's absolutely no medical reason for denial. "Mr. Martinez, I believe I can help you. The procedure you need is well within my expertise." Frank shakes his head. "I appreciate that, Doc, but if the hospital won't take my case, let me worry." "About the hospital," Eliza interrupts gently. "For now, I'd like to do a proper examination and get some updated scans." The next morning, Eliza arrives at the hospital earlier than usual. She accesses the computer system and searches for any rejected veteran cases similar to Frank's. To her dismay, she finds 17 cases in the past year alone, all veterans, all with VA referrals, all denied for insufficient documentation or failure to meet priority guidelines. Her concentration is broken when Dr. Michaels, the hospital's chief of surgery, appears at her door. "Working early, Chen? That's dedication." His tone is friendly, but his expression is cautious. "Just getting familiar with our patient demographics," she replies casually. "I noticed something interesting about our acceptance rates for VA referrals." Dr. Michaels shifts uncomfortably. "Ah, well, those cases can be complicated. Insurance issues, you know. Actually, federal law is quite clear about hospitals' obligations to veterans with VA referrals," Eliza says, her voice still pleasant, but her eyes sharp. "Especially hospitals that receive federal funding, as Westside does. You should discuss this with administration," Dr. Michaels says quickly. "Speaking of which, Dr. Wells mentioned you were interested in some research project. The timing might not be ideal with your recent arrival." Eliza recognizes the deflection but stays focused. "Dr. Michaels, in your 30 years here, have you noticed a pattern in which patients get fast-tracked and which get rejected?" The question hangs in the air between them. Finally, Dr. Michaels sighs, closing Eliza's office door. "Look, Chen, you're new here. There are priorities at Westside. Dr. Wells and the board have certain metrics they focus on: profit margins, insurance reimbursement rates, patient demographics that look good in our annual reports." He lowers his voice. "Between us, I don't agree with all their policies, but I've learned to pick my battles." "And veterans' care isn't a battle worth picking?" Eliza asks quietly. Dr. Michaels has the grace to look ashamed. "I do what I can within the system. We all make compromises. Some compromises cost more than others," Eliza replies, "especially when measured in human lives." After Dr. Michaels leaves, Eliza continues her investigation, documenting each rejected veteran case meticulously. She also schedules Frank for an evaluation consultation, carefully coding it in a way that wouldn't trigger administrative review. When Frank arrives for his appointment, Eliza performs a thorough examination and confirms her initial assessment. The procedure he needs is relatively straightforward for someone with her training, but time-sensitive. "The good news is, this is completely treatable," she tells him. "The not-so-good news is we need to navigate some administrative hurdles." Frank smiles wryly. "Story of every veteran's life, Doc." "Not this time," Eliza says with determination. "I'm going to make this right." Over the next 3 weeks, Eliza documents every instance of discrimination against veterans at Westside. She reviews historical data, interviews staff members who trust her, and even speaks confidentially with other veterans who've been turned away. The pattern is undeniable and disturbing. Meanwhile, Dr. Wells escalates her efforts to control Eliza. She reassigns Eliza's support staff, schedules her for the least desirable surgery time slots, and implements a review process for Eliza's cases that doesn't apply to other surgeons. "Dr. Chen, your surgical schedule has been modified," Rebecca informs her one morning, sliding a revised printout across the desk. "We need your expertise on these high-priority cases." Eliza scans the list. "All wealthy patients with premium insurance plans." "And what about my previously scheduled patients? Reassigned to other surgeons. We're maximizing efficiency." "Including Mr. Ramirez, the veteran with the arterial blockage?" Eliza asks, already knowing the answer. "His case has been deferred pending further insurance verification," Rebecca replies smoothly. Standard procedure. Eliza maintains her professional demeanor, but her resolve strengthens. That evening, she contacts a former colleague who now works at the Department of Veterans Affairs Office of Inspector General. "This isn't just anecdotal, Mark," she explains, sharing her findings securely. "Westside has systematically denied care to veterans while accepting identical cases from patients with premium insurance. I've documented everything. This wouldn't be the first hospital to prioritize profit over veterans," Mark replies grimly. "But your evidence is compelling, Eliza. We can open an investigation, but these things take time. Some of these veterans don't have time," Eliza counters. "I need a more immediate solution." The following day, Eliza faces her biggest challenge yet. Frank Martinez arrives at the emergency room with severe pain and compromised circulation in his leg. Exactly the complication she'd feared. When she attempts to admit him for emergency surgery, Dr. Wells intervenes personally. "This patient hasn't completed the required insurance verification," Rebecca states firmly, standing in the doorway of the examination room. "He's experiencing acute vascular compromise," Eliza argues. "This is an emergency situation. That's your clinical opinion." I'm requesting a second evaluation before we commit resources. Frank watches this exchange with growing distress. Doc, I don't want to cause trouble. Maybe I should just go to the VA hospital downtown. The VA doesn't have the specialists to handle this, Eliza explains gently. Then to Rebecca, denying emergency care is not just unethical, it's illegal. No one is denying care, Dr. Chen. We're following protocol. Rebecca's voice is ice. Perhaps you should consider whether your personal connection to veterans is clouding your medical judgment. Something in Eliza snaps. Years of watching her father face similar dismissals, months of observing systemic discrimination, and now, this blatant endangerment of a patient's life. It's too much. My medical judgment is perfectly clear, she replies, her voice deadly calm. I'm admitting Mr. Martinez now under my care, and I'm performing his surgery this afternoon. If you interfere, I will file a formal report with the medical board citing patient endangerment. I've documented every aspect of this case, and I'm prepared to make it very public. The two women stare at each other, neither willing to back down. Finally, Rebecca says, "This isn't over, Dr. Chen," and walks away. Eliza turns back to Frank, who looks both impressed and concerned. You didn't have to do that. Actually, I did, Eliza responds, checking his vital signs. Now let's fix that leg. The surgery is successful, but Eliza knows she's crossed a line from which there's no return. When she exits the operating room, Dr. Michaels is waiting for her. That was a dangerous game you played today, Chen. It wasn't a game. It was medicine, she replies, removing her surgical cap. The kind we're supposed to practice. Wells is furious. She's talking about insubordination, protocol violations. Let her. Eliza meets his gaze steadily. While she's at it, she can explain to federal investigators why Westside has been systematically turning away veterans in violation of at least 3 federal laws. Dr. Michaels stares at her. What did you do? What someone should have done years ago, Eliza answers. I gathered evidence. That night, Eliza finalizes her plan. She's compiled irrefutable documentation of Westside's discriminatory practices, but she needs to force immediate change, not just eventual consequences. She contacts every veteran she's identified from Westside's rejection records, along with local veterans advocacy groups and several journalists who specialize in healthcare and veterans issues. In her apartment, surrounded by files and digital records, she practices what she'll say at tomorrow's board meeting, a meeting she wasn't invited to but plans to attend anyway. On her computer screen is a draft press release detailing Westside's practices, ready to send with one click if necessary. Her phone rings. Dr. Michaels. They're planning to suspend you tomorrow, he warns. Wells has convinced the director that you're a liability. I expected as much, Eliza replies calmly. Thank you for the heads up. Chen, think about what you're doing. Your career is meaningless if I'm not using it to help people who need it, she finishes. I watched my father die because he couldn't get proper care. I won't stand by while it happens to others. There's a long silence. What can I do? Dr. Michaels finally asks. Eliza smiles. Be at the board meeting tomorrow. Bring anyone else who might be willing to speak up. The next morning, Eliza arrives at the hospital to find security waiting to escort her to the director's office. Not the boardroom. She goes without protest, knowing timing is everything. Hospital director Harold Patterson sits behind his expansive desk, with Rebecca Wells standing beside him looking triumphant. Dr. Chen, your actions yesterday constituted a serious breach of hospital protocol, he begins. Which protocol specifically? Eliza asks. The one where we provide emergency care to patients in need, or the unwritten one where we turn away veterans because they affect our profit margins? Patterson's face reddens. That's an outrageous accusation. It's a documented fact, Eliza counters, placing a thumb drive on his desk. 17 veterans turned away in the past year despite valid VA referrals. Different doctors, different conditions, same pattern of rejection. Meanwhile, patients with identical conditions but premium insurance are accepted without question. You've been accessing confidential records without authorization, Rebecca interjects. I accessed patient data as a practicing physician at this hospital, investigating what I believe to be violations of federal law and medical ethics. Eliza remains composed. The Veterans Access to Care Act is quite specific about hospitals' obligations. This is absurd, Rebecca scoffs. We follow all legal requirements. Then you won't mind explaining that to the 50 veterans gathered in your lobby right now, Eliza says quietly. Or to the reporters from the Chronicle and Channel 7 News who are interviewing them about their experiences at Westside. Or perhaps to the VA Inspector General's office, which opened an official investigation this morning. The color drains from Patterson's face. What have you done? created transparency, Eliza replies simply. The board meeting starts in 10 minutes. I suggest we continue this discussion there, with all stakeholders present. When they enter the boardroom, it's already crowded. Dr. Michaels has brought several physicians and nurses who've witnessed the discrimination firsthand. Community advocates are present, along with Frank Martinez and other veterans who've been denied care. Local media representatives stand ready with cameras and recorders. What is the meaning of this? Demands Bernard Weston, the board chairman. This is a private meeting. Not today, Eliza responds, taking a position at the front of the room. Today, we're going to have an honest conversation about Westside Regional's treatment of veterans. For the next hour, Eliza presents her evidence methodically, spreadsheets showing acceptance rates based on insurance status, testimonials from veterans who were turned away despite valid referrals, documentation of identical cases treated differently based solely on insurance or income factors, internal memos suggesting a deliberate policy of discouraging certain low-yield patients. Frank Martinez speaks about his experience displaying his leg. Thanks to Dr. Chen, I still have this leg. Without her intervention, I might be looking at amputation right now. Other veterans share similar stories, many breaking down as they describe being rejected in their moments of greatest need by the very country they'd served. Throughout the presentation, Rebecca Wells attempts to interject with explanations about complex insurance verification procedures and resource allocation challenges, but each excuse is systematically dismantled by Eliza's meticulous research. The atmosphere in the room shifts as board members begin to realize the full scope of the problem and their potential liability. The chairman calls for a brief recess, during which Eliza is approached by Dr. Michaels. You've started something that can't be stopped, he says, both warning and admiration in his voice. That's the idea, Eliza replies. When the meeting reconvenes, Chairman Weston addresses the room with a notably different tone. On behalf of the board, I want to express our profound concern about the issues Dr. Chen has brought to light. If her allegations are accurate, and they appear to be well documented, then Westside has fallen short of its mission and its legal obligations. Rebecca begins to protest, but Weston silences her with a raised hand. Effective immediately, the board is initiating a comprehensive review of our acceptance policies, particularly regarding veterans' care. Dr. Chen will head this review committee. Eliza steps forward. With respect, Mr. Chairman, that's insufficient. These veterans need care now, not after a lengthy review process. What are you proposing? Weston asks. First, immediate acceptance of all VA-referred veterans currently on the rejection list. Second, a dedicated Veterans Care Coordinator position to ensure proper processing of VA cases. Third, mandatory training for all administrative staff on veterans' health care rights and hospital obligations. And fourth, a formal apology to every veteran who was improperly denied care. The room falls silent as the board members exchange glances. Finally, Weston nods. Those terms are acceptable as an initial response. We'll need to discuss further structural changes. There's one more condition, Eliza adds. Dr. Wells should be reassigned to a position where she no longer makes patient acceptance decisions. Rebecca gasps. This is outrageous. You can't possibly. It's that, or face the consequences of a federal investigation and multiple potential lawsuits, Eliza interrupts calmly. Your choice. The story breaks across local media that evening. Westside Hospital overhauls veterans' care after doctor exposes discrimination. Frank Martinez's successful surgery is featured prominently, along with interviews with other veterans who'd been turned away. Dr. Chen becomes an overnight sensation, portrayed as a medical professional who risked her career to stand up for marginalized patients. Social media explodes with the hashtag #StandLikeEliza, as veterans around the country share their own healthcare struggle stories. The hospital's phone lines are flooded with messages, some critical of their past practices, but many supportive of their new commitment to reform. Rebecca Wells takes an extended leave of absence the following week. Hospital Director Patterson issues a formal apology at a press conference, announcing the implementation of all Eliza's recommendations, plus additional measures. A dedicated veterans care wing with specialized services, hiring preferences for medical professionals with military backgrounds, and a community advisory board that includes veteran representatives. Dr. Michaels approaches Eliza in the doctor's lounge after the announcement. You've changed everything. Not yet, she replies, but it's a start. In the months that follow, Westside becomes a model for veterans care. The Veterans Care Coordinator, a position filled by a retired military nurse, ensures that no veteran falls through administrative cracks. Wait times for VA-referred patients drop dramatically. Specialized services are expanded to address common veterans' health issues. Frank Martinez completes his recovery and becomes a regular visitor at the hospital, volunteering to support other veterans navigating the healthcare system. He and Eliza develop a friendship based on mutual respect and shared purpose. You know what the best part is? Frank tells her one day as they walk through the newly established Veterans Care Wing. It's not just about the medical care. It's about being seen, being treated with dignity. That's something many of us haven't felt since we took off the uniform. The transformation extends beyond Westside. Other hospitals in the region, noting the positive publicity and community support Westside has received, begin reviewing and reforming their own veterans' care policies. The State Medical Association invites Eliza to develop guidelines for veterans' healthcare access that are subsequently adopted statewide. Dr. Wells eventually resigns from Westside entirely, taking a position at a private concierge medical practice across town. Hospital Director Patterson, recognizing which way the wind is blowing, becomes an enthusiastic advocate for the changes, frequently citing the improved community relations and unexpected financial benefits. Turns out, providing good care to veterans whose treatment is guaranteed by federal programs is actually profitable when processed correctly. At a small ceremony marking 6 months since the changes began, Chairman Weston presents Eliza with an award for distinguished service. Dr. Chen reminded us of our core mission as healthcare providers, he says to the assembled staff and community members. In doing so, she didn't just help veterans, she helped Westside rediscover its soul. Eliza accepts the award graciously, but deflects the praise. The real heroes are the veterans who had the courage to speak up about their experiences, and the hospital staff who embraced change when it would have been easier to maintain the status quo. After the ceremony, Dr. Michaels confides in her. I've been at Westside for 30 years and I've never seen such positive transformation. You know, I was worried about my reputation, my position. I told myself I was picking my battles, but the truth is, I was just afraid to rock the boat. We all make choices based on the information and courage we have at the time, Eliza replies. What matters is being willing to make different choices when we know better. 1 year after that fateful day when Eliza witnessed Frank being turned away, Westside Regional hosts a community health fair focused on veterans services. The hospital grounds are filled with information booths, health screenings, and resources not just for physical health, but also for mental health, housing, employment, and other veteran-specific needs. Frank Martinez, now serving on the hospital's Veterans Advisory Board, leads tours of the Veterans Care Wing. A year ago, I couldn't even get through the front door, he tells visitors. Now we have our own entrance. He says it with pride, not bitterness, a testament to how completely things have changed. Eliza, recently promoted to Chief of Surgical Services after Dr. Michaels' retirement, watches the activity with satisfaction. Her father would have been proud, not just of her stand, but of how many others stood up once someone showed it was possible. A young medical student approaches her hesitantly. Dr. Chen, I read about what you did here. It's actually why I applied for my residency at Westside. I was wondering if you might have time to talk about your approach to patient advocacy. Eliza smiles. Always. That's how change becomes permanent, when it inspires the next generation. In her office, now located where Rebecca Wells once was, Eliza keeps a simple plaque that was given to her by the Veterans Group. It reads, "For remembering that medicine is not just about treating conditions, but about seeing people. Thank you for seeing us." The local news station that initially broke the story produces a 1-year follow-up special titled, How One Doctor Changed a Healthcare System. It features before and after interviews with veterans, hospital staff, and community members. The most powerful testimony comes from a VA administrator. We used to dread having to refer patients to Westside because we knew they'd likely be rejected. Now we seek out those referrals because we know our veterans will receive exceptional care. The piece ends with Eliza's simple philosophy, which has become something of a mantra at Westside. Healthcare is a right, not a privilege, especially for those who've served. Our job is to remove barriers, not create them. Across town, in her new private practice office, Rebecca Wells watches the special with a frown. Her clientele is exclusive and lucrative, but her influence in the broader medical community has waned. The story of her role in the veterans' discrimination has followed her, despite her attempts to reframe the narrative. Meanwhile, other hospitals across the country have begun contacting Westside for guidance on implementing similar veterans' care programs. What started as one doctor's stand for one patient has evolved into a movement for systemic change. Frank Martinez, his health fully restored, now mentors other veterans going through medical challenges. When you're sick and in pain, The last thing you need is to fight the system that's supposed to help you, he tells them. Thanks to Dr. Chen, we don't have to fight anymore. We just have to heal. The transformation of Westside reminds us that systems don't change themselves. People change them, often at personal risk. One person with courage can break through years of, "that's just how things are," and reveal that things can be different, better, more just. Have you witnessed someone standing up against an unfair system? Maybe you've been that person yourself. We all face moments where we have to decide whether to accept the status quo or challenge it, even when doing so might cost us. The story of Eliza and Frank shows us that sometimes the greatest impact comes not from working within broken systems, but from having the courage to confront them directly. One doctor changed everything, not just for one veteran, but for an entire community. Share your story in the comments below, and don't forget to subscribe for more inspiring true stories of everyday heroes making extraordinary differences. Remember, change doesn't always require grand gestures. Sometimes it starts with simply refusing to turn away when others need you most.